My name is Shane Scott. I am board certified in internal medicine and pediatrics. I practice here in New Albany, my hometown. A lot of times people don't think about checkups until something goes wrong, but that's not how we would think about our car or maybe an expensive ring that we have that we go get cleaned every once in a while. So that's really how we should think about our health too. So even though there might not be a problem, we should go have a checkup. And so it varies by ages. So for infants, when they're getting shots, it's really easy for parents to remember when they should get their checkups, typically at 3 to 5 days old, right after birth, at 2 weeks old, and the shots start at 2 months old. So 2 months, 4 months, 6 months, 9 months, a year, and then several times between 1 and 2 years old. However, once they get that 4-year-old shot to begin school, most parents don't think about it again until 7th grade, which is really not a great thing because there's so much development and things going on during those years that we really need to follow that to make sure there's no hiccups along the way so we can address those quickly. So it's very important, even though nothing may be going wrong, just think of it like you're getting your oil changed. Your car's still running well, but we go get our oil changed every 3,000 to 5,000 miles. So the same thing with our health. Even though nothing's going wrong, we still need those yearly checkups. So after someone turns 4 years old, it's a good idea to get one at least once a year. A check-in involves different things for different ages. So kids between just born to around 18 months old, most checkups are going to involve shots. So getting those immunizations up to date to help protect from any illnesses. After about 18 months old, between 18 months old and 4 years old, it's more about development. Are they speaking correctly? Are they walking? Are they using their grasp of their fingers correctly? Are they able to climb stairs? How are they communicating? So those are the things that we talk about a lot between that 18-month-old and 4-year-old checkup. 4-year-old checkup is those school shots that you can actually get between 4 and 6 years old, but most people choose to get them at 4 because the children are easier to coerce into getting those, so it makes it a little bit easier. And after that time, it's just mainly about how we're growing and how do we parent those kids well for things that might be coming up in the next 3 to 4 years. And then as they get to be teenagers, we hardly ever see the kids. Only if they get strep throat, flu, or some illness. That's a really critical time to really check the cholesterol to see if that's going to be a problem as they get older, to make sure that the transitions through puberty and those ages are going well and there's no unexpected things that could be occurring. So there's a lot of things that we just leave to chance oftentimes instead of kind of confirming that things are going okay and preparing them for their years ahead to make sure that they stay healthy. One of the important things that we can all do is establish a medical home. So a medical home is somebody that knows you well, somebody that knows your family, somebody that knows your mom and dad and maybe the other kids, so they understand your family history without really even asking. So having fragmented care is really a disservice, okay? So I encourage people to find someone that they trust and like and keep that follow-up going with them. So it's going to be important that you have your checkup with whoever your medical home is with, your provider. The other thing that's very unique and very helpful in our community is Baptist Hospital offers a school health fair, and it's going to be August the 11th this year. The good thing about the health fair is there are some screenings there that are very helpful, but the best thing about the health fair is there is resources. So a lot of people don't even know what resources we have here in New Albany and Union County. And so even though you may not need them, there's a likelihood that you might run into someone who knows a certain problem, they might need that resource. So it kind of lets you know, hey, this is what's out there. And my neighbor may mention a problem to me and I can refer, hey, I saw this at the Baptist Health Fair, you may want to give them a call. So Baptist Health Fair, August 11th, some screenings there, some fun for the kids as well. But also it's just knowing that, hey, these resources are in our community.